Hello, my name is Ali. I'm doing primary survey, CPR, and AED practical. So first of all, we have to check the danger. If there is any danger around for you, for casualty, we have to move this one first. Then we have to check the response of the patient. We will tap the shoulder. Hello, you okay? Hello, you alright? Can you listen me? Hello, can you listen me? Then we have to check the airways. Is there any blockage in the airways, nose or mouth? We have to check. We have to remove the blockage if there is any. So there's no blockage. Then we have to check the breathe. For breathing, we have to put our air in between nose and mouth and wait for 10 seconds. And we have to put our eyes on the chest side, like this. Yeah, the patient is now breathing. So ask someone to call the ambulance and bring the AED. Please call the ambulance and bring the AED. So I'm removing his clothes and I'm doing the CPR now. 30 chest compression and 2 mouth breath. So between center of the chest, put one hand on here and then lock the other with the other hand and keep straight these arms. Then 30 chest compression with the rate of 100 and 120 per minute, mean estimately 2 chest compression in 1 second. Then we have to carry on with the 2 mouth breath. Pinch the nose. So if this patient carry on the CPR, if the patient stop breathing, is fine. If he's still not breathing, then use the AED. The AED box is here with me. First of all, we have to get the connector out. There are 2 pads. One would be we have to apply on the right side of the chest, upper chest, and the one, if it's an adult, we have to put on side of the chest. If it's a child, the first one would be in the middle, the other one will be the back side of the chest. So this is the adult body. We have to do the first one right side, upper side of the body here. The second one will be applied on this side here. I already connected with the connectors. So turn on the machine and follow the instructions.
Remove pads from package and apply to patient's bare chest. Apply pads to patient's bare chest as shown in the picture. Plug in pad. Do not touch the patient. Analyzing heart rhythm.
Follow
Shock
the machine.
advised. Charging. Stay clear of patient.
Everyone stay clear.
Deliver shock now. Press the shock button now. Shock delivered. Start CPR. Breathe. Breathe.
Carry on this process and follow the instructions of the AED machine until ambulance arrive or you are exhausted or until the patient start breathing normally. Thank you.